There is a new technology that's helping prostate cancer patients with those harsh side effects of treatments. You know, Ron is off this week, but before he left, he really made it a priority to get this interview to you. It's with Dr. Barker with Urology Partners of North Texas, and here's more.
And Dr. Jerry Barker is joining us now from his office in Fort Worth with more on this. Dr. Barker, thank you for being a part of our show.
Thank you.
Let's start with some of the basics here when it comes to men and prostate cancer. I know that when it comes to that annual physical, we hope all men get them, there's the PSA test. What exactly is that, and what kind of a marker is that for prostate cancer?
PSA is a protein found in the blood that can indicate the presence of prostate cancer. So starting about age 50, men often have this test performed once a year so that their personal doctor, their primary care doctor, can help them determine if they are at risk for possibly having a silent prostate cancer.
If it runs in your family, should you get that PSA test at a younger age?
That is absolutely true. So there are some families who have a gene that passes through the family that leaves men at higher risk than average for having prostate cancer. And so there are families that we counsel to start having PSA testing as early as age 45 or even 40 in some cases.
So course of treatment, as I understand it, is sometimes a partial or full removal of the prostate, but radiation also can accompany this treatment. Are there concerns when it comes to radiation? We've heard this with cancer treatments in general, that the radiation is to target the cancerous cells, but at times healthy cells can be compromised as well.
Yes, that's right. The problem treating many cancers is that there are normal body parts and tissues right around where the cancer exists. And so our goal is to try to treat and eliminate the cancer, but not harm or injure any of those normal tissues around where the cancer is.
So enter this new technology, and you can describe for us how new it is or how widely used it is. Am I saying this correctly? SpaceOAR hydrogel?
That's it exactly.
Okay, so how does it work?
It is essentially a water-based gel that can easily be injected right between the rectum and the prostate. That's two organs that usually sit right next to each other. But the presence of the spacer gel moves or nudges the prostate and the rectum just a little bit further away from each other so that we can treat the prostate and the cancer with lots of radiation and give a good chance of being cured, but at the same time not harm the rectum. And that used to be one of the big problems with radiation treatment for prostate cancer.
So is this an injection you have to have every time you have a radiation treatment? Is it invasive? And is it painful? I know there's three questions there all in one.
Those are good questions. So fortunately, it is a procedure that you only have to have one time before all of the radiation treatments begin. And the gel is designed to last intact for about 3 months. And then because it is mostly water, it just naturally dissolves. And fortunately, the procedure to place the gel is not very uncomfortable. Does not require general anesthesia. It can be done in the outpatient setting, but it is a one-time procedure.
I'm curious to know the advent of this technology. How has it changed the way in which you're able to communicate to a patient, the prognosis, how much better the treatment or easier the treatment might be? Has it changed that dynamic? And do you think it's encouraged more men to be less anxiety-ridden by the idea of getting treatment for prostate cancer?
I think that's true. I think it has changed the conversation because patients know that in the past, curing the cancer was the primary goal, but some patients were left to suffer with side effects. Whereas now, to be able to reassure patients that, yes, we want their cancer treated, but at the same time, we want them to have good quality of life and live as normal a life as possible after cancer. You know, that's a lot of good news.
Yeah, and we stress it a lot, men. Have that annual physical, be your own health advocate, ask your doctor about that PSA test if you're 50 or older. If it runs in the family, do it earlier, do it sooner, ask about it. And God forbid, if you're diagnosed with the prospect of prostate cancer, they can learn more about space or hydrogel and ask specifically about it. That's why we're here to inform people. Dr. Barker, thank you.
Thank you.
Thank you, Ron. Thank you, Dr. Barker. So here is the website. Grab your notes app or jot this down really quickly. It is Dr. Barker at Urology Partners of North Texas, upnt.com/services-space-oar.html. So there's the site, and I want to give you one more site as a resource. It is this, spaceoar.com, again, to get connected with Space OAR.